Leader, third party.
Thank you, Honourable Speaker. We can't turn a blind eye to the unequal impacts of this epidemic if we are not actively anti-racist in our pandemic policy development. We risk compounding the systemic racism that has long existed in BC. As was just reported in the Vancouver Sun, quote, "The consequence of the race-based data gap has been especially stark during COVID-19. Public health officials have been unable to definitively say whether racialized groups are infected with the virus at higher rates." And as my colleague from Saanich North and the Island notes in that same article, if you don't ask the questions, you don't collect the data, you become colorblind to the nuances of the way policies are affecting outcomes for different people. My question to you, Honourable Speaker, is again to the Premier. In June of last year, he wrote to the BC Human Rights Commissioner and requested her advice on how to move forward with the collection of race and ethnicity-based data. Yet 9 months later, no work has been done on the suggestions put forward by the Commissioner, meaning we have no data capable of informing our vaccine rollout plan. Why has this not been a priority for the Premier?
Minister of Health.
Thank you very much, Honourable Speaker, and thank you to the member for her question and for her interest. As with all pandemics and with all serious diseases and ailments that face people, they're profoundly affected by what we call the social determinants of health, by income, by ethnicity, by race. Indeed, all of these things play a role. Every case is important, and every case is followed here in British Columbia. And that's why we've engaged in the program that we are engaging in, to immunize those who are most vulnerable first. That includes, because the evidence shows this, our elders. In the case of this immunization, those in long-term care is why we comprehensively immunize long-term care and assisted living. It was based on the evidence. It's why we are providing immunization in rural and remote Indigenous communities, because of the vulnerability of those communities to pandemic. It's why, with respect to Indigenous people, we're immunizing 65 and above during the period in the general population. We're immunizing 80 and above. So our policies have been informed by who's been affected. Our policies and direction has been informed by the concerns of regions and by people, because every case matters. Every single case matters. We take it all, as you can imagine, very seriously, both at the Provincial Health Office, the Ministry of Health, and throughout the government. Can we do a better job in future? Yes. But I think that our Provincial Health Officer, Dr. Bonnie Henry, our Deputy Provincial Health Officer, Dr. Daniel Ben-Smith, the Premier and others have been very concerned about these very questions and responding to them, and you see that reflected in our immunization plan.
Leader, third party.
Thank you, Honourable Speaker. And the Health Minister does indicate that decisions are being made using data and evidence, but they're being made by the data and evidence that's being collected. Let's look, for example, at Manitoba. Yesterday, Manitoba released a report showing how COVID-19 has disproportionately impacted Indigenous, Black, and other people of colour in the province. Why was this possible? Because Manitoba started collecting race-based and socio-economic data in May 2020. What does the data tell them? Despite being 35% of the population, Manitobans who identified as Black, Indigenous, and people of colour make up over half of the total of COVID cases in the province. This is not a naturally occurring disparity. It is created by policy. The disproportionate impact of COVID-19 is systemic, and it is seen in every jurisdiction, according to Dr. Brent Rusin, Chief Provincial Public Health Officer of Manitoba. It's not about people in communities making bad choices. COVID-19 infections are largely linked to pre-existing inequities, including housing and employment, factors impacted by government policy. My question through you, Honourable Speaker, is to the Premier. The best time to start collecting and sharing disaggregated data was a year ago. The next best time is now. The Premier has directed his ministers to apply an anti-racist lens in their work. Will he now commit to collecting and sharing the data that will ensure that the ministers will have accurate information to be able to determine how COVID has exacerbated inequities in our province?
Minister of Health.
Honourable Speaker, we know because every case matters that COVID-19 has affected people differently in the province. First of all, our elders, but also in other communities. Some communities have seen a profound effect, both as regions and as communities of people. And so we have taken action to address that. It's why you see such a diversity of languages in our advertising and our reaching out to people, why we've continued to do the work that we need to do to keep everybody safe. In June of this year, the member will know, as part of our anti-racist commitment, we launched a commission into racism against Indigenous people in healthcare that provided a comprehensive report in 5 months that we are acting on. All of the recommendations, because these issues should be central to what all that we do. These issues affect all that we do, and we're going to continue to do everything we can to ensure that those most vulnerable, those most affected by the COVID-19 crisis, are provided protection. That's seen in every part of our immunization plan, and it's seen in all of our efforts to try and reach out to communities and provide the maximum protection possible. There is no question that people's circumstances make them more vulnerable to having COVID-19 transmitted to them. And people's circumstances mean that the impact on it is greater in some communities. We saw and we see, for example, in some of our lowest income neighborhoods in BC, the actions taken by public health to protect people, those systematic actions. I'm very proud of those communities, and very proud of the actions taken. Again, can we do more? You bet we can. Will we do more?
Thank you,
yes,
Minister.
we will. But I think the task and the job that we're doing now reflects our commitment to the very issues the member raises.
Thank you.